Hello everyone, we are going to start a lecture known as ventricular septal defect. This lecture for B.Sc nursing third year students, and we are going to start our chapter related to cardiovascular disorder. And I pick first one is ventricular septal defect. Hope so you feel comfortable and fine. You're sitting home and stay at home, be safe, and keep learning. Continue. First of all, we are going to discuss about the introduction of ventricular septal defect, definition, pathophysiology, types of VSD, classification, clinical manifestations, diagnostic tests, treatment, and nursing management. First of all, what is VSD? VSD is a ventricular septal defect. It is the miscommunication between the right ventricle and left ventricle. According to the definition, VSD is a congenital defect in the interventricular septum and that allows shunting of blood between the left and right ventricles. It is a congenital defect means baby born with this defect. If it is acquired defect, then after the birth, baby obtain this problem from the environment and from any other reason. Introduction of the VSD. VSD are the most common congenital heart defects in infants and children, and VSD is seen in up to 3.5 infants per 1000 live births. Most of these close spontaneously in childhood. Spontaneously means by naturally closed. VSD may also accompany other congenital defects. Then we are going to discuss about the pathophysiology. Pathophysiology of the ventricular septal defect. Before knowing the pathophysiology of the ventricular septal defect, you need to know about the normal circulation of the heart. Let's see. I would like to explain. With the help of inferior and superior vena cava. Actually, superior and inferior vena cava collect the blood from the body, that is the deoxygenated blood, or blood consists of poor oxygen, pour into the right atrium, and through the tricuspid valve blood entered in the right ventricle, and with the help of pulmonary artery it's raised to the lungs. From in the lungs it purified, and with the help of pulmonary vein it entered in the left atrium, and through the mitral valve it proceed in left ventricle, and with the help of aorta oxygenated blood give oxygen to all the organs present in the body. Okay, but what happened in ventricular septal defect? Because it's away from the normal, it has a abnormal connection between the right ventricle and left ventricle, which are usually not present in normal child. The left ventricle have a more pressure of the blood, and it pushed the blood to the right ventricle. Right ventricle have deoxygenated blood, or blood with less oxygen. There pulmonary artery take the mixed blood from the right ventricle to the lungs for purification. That is the reason behind the child suffering from ventricular septal defect do not show the symptom, that is cyanosis. What is the cyanosis? Bluish discoloration of the skin due to poor circulation or inadequate oxygenation of the blood. I hope you understand. Okay. Then we have to proceed. Types of VSD. If you want to understand it better, then kindly see the diagram given in this picture. In this slide, ventricular septal defect, there is some numbering are there in the right ventricle, 1, 2, 3 and 4. It help you to understand better. The first one is conal septal VST. In the diagram, you can see near the pulmonary valve, number 1. The rarest of VST means very less child born with conal septal defect. It occurs in the ventricular septum just below the pulmonary valve. In the diagram, you can clearly see the number written in the form of 1. Okay. Then the perimembranous VST, where you can see the number 2 located near the valve. Here the pulmonary valve present, and in that place the perimembranous VST occur. This type of VST is the one that is most commonly treated by surgery because most do not close on their own. Okay. Then the third one is atrioventricular canal type. Means this abnormality or this type present where the connection of right atrium and right ventricle means near the valve. This VST is associated with atrioventricular canal defect. The VST is located underneath the tricuspid and mitral valves. Tricuspid valve also known as mitral valve. Then muscular VST, the most common type of VST. It is an opening in the muscular portion of the lower section of the ventricular septum. A large number of these close spontaneously and do not require surgery. You can clearly see in the diagram. I hope you understand this. If you feel discomfort to understand this, I am here to help you. Do not worry at all. Next is classification. It is small VST and large VST. Depends on its centimeter. If it's less than 0.5 centimeter, then it's small VST and it closes naturally. No need to surgery. Then large VST, usually greater than 1 centimeter, 90% require surgery. Okay. Then clinical manifestations. In clinical manifestation, there are murmur sound during auscultation. What do you mean by murmur sound? You know, the sound of your heartbeat is lub-dub, lub-dub. Okay? In some people, the blood makes an extra noise as it flows through the heart. And that sound we can heard with the help of stethoscope in between the lub and dub. This sound is called a murmur. Doctors usually discover murmurs during regular checkups of the kids, just like kids murmur have a grades. Grade 1 is the softest sounding murmur. Sound means sound of the first grade is very soft and sound of the grade 6 is very loud. Fine. Then fatigue. The kids suffering from VST feel tired, fatigued and have sweating, also with rapid breathing. What do you mean by rapid breathing? When you take more breathing than normal in a given minute. When the child take more breathing than the normal range, okay? Congested breathing, when any congestion in the nasal cavity due to inflammation or any other reason, okay? Then anorexia, the child lost appetite, then They do not gain the proper weight according to age and according to criteria which we read in the books. Cyanosis, we already discussed. Cyanosis is bluish discoloration of the skin due to poor circulation or inadequate oxygenation of the blood. I hope you clear. Then diagnostic tests for the V.Sc. Echocardiogram used to define the anatomy and characteristics of the shunted blood. Then also X-ray to roll out the size of the heart. In X-ray, the size of the heart little more than the normal size, and the side of the right ventricle larger than the normal. Understand? Continue with diagnostic test. There is ECG. Right ventricular hypertrophy means right ventricular large than the normal. Large bific QRS complex, biventricular hypertrophy develops. Biventricular hypertrophy means right ventricle or left ventricle. Both the size of the both ventricle are large. Why right ventricular hypertrophy? Because the left ventricle pushed the blood into the right ventricle, and right ventricle already taken the blood from the right atrium. Right ventricle take the blood from the right atrium and also from the left ventricle, and there is a collection of blood. That's why the size of the right ventricle is more than the normal. Then treatment. First of all, we would like to talk about the medical management with digoxin, furosemide, bisoprolol. Okay, digoxin increase the strength of the heart's contraction. Furosemide is a diuresis and decrease the amount of fluid in circulation and in the lungs. Then bisoprolol keep the heartbeat regular. Then surgical management. Catheter procedure inserts a catheter into the femoral vein just like angiography and threads it to the heart septum. The device is positioned so that it plugs the hole between the ventricles. Then open heart surgery. If the catheter procedure not successful, then the next option is open heart surgery, but it rarely used in VST. Okay. The next is preoperative and postoperative care. Prophylactic antibiotics are often required to prevent infectious endocarditis. Endocarditis, what is endocarditis? It is inflammation of the endocardium. The child should be assessed postoperatively for dysrhythmia. Dysrhythmia means a normal rhythm of the heart. When the normal rhythm distracts, that is known as dysrhythmia. Since edema in the septum may interfere with the condition. The next is nursing management. First is nursing diagnosis, decrease in cardiac output associated with heart malformations. Our goal to improve cardiac output, and intervention provided to the patient are observe the quality and strength of the heartbeat, peripheral pulses in color and warmth, assess the degree of cyanosis, monitor signs of congestive heart failure. Which signs? Anxiety, tachycardia. Tachycardia, the heart rate is fast than normal. Tachypnea, the breathing is more than normal. Shortness of breath. Periorbital edema, it's the swelling around the eyes. Oliguria, production of urine reduced in kids. And hepatomegaly, the size of the liver large than the normal. Okay. Next is nursing diagnosis, impaired gas exchange related to pulmonary congestion. And our goal, improved gas exchange, and we have given intervention to the patient, monitor the quality and rhythm of breathing, adjust the position of the child with follow position, avoid child of an infected person, give adequate rest, give oxygen as indicated. I hope you're clear with this topic. If you face any kind of problem, kindly intimate me. I'm here to help you. Stay at home. Wash your hand frequently. Take care of your family. Thank you very much. I hope you understand. Thank you very much.